Welcome everyone. Today we'll be discussing emergency medical services or EMS systems. EMS refers to a network of services similar to the one we rely on for emergency healthcare. It provides pre-hospital care, which means care given to patients before they reach a hospital. EMS is crucial in our healthcare system because it is often the first point of contact for patients needing urgent medical attention. It plays a vital role in saving lives and reducing morbidity. Let's explore the main components of EMS systems: dispatch centers and communication. These hubs receive emergency calls and coordinate emergency services responses. These include paramedics, advanced emergency medical technicians, and emergency medical responders, who provide care on the scene. Their expertise is vital in assessing and managing various medical emergencies. Equipment and vehicles used in EMS. Emergency vehicles like ambulances are equipped with medical supplies necessary for immediate patient care, including defibrillators, oxygen, and stretchers. There are several critical phases in EMS response. 1. Call for assistance. The process begins when a call for help is made, activating the dispatch center. 2. On-scene response. The EMS team rushes to assess the situation and provide care. 3. Patient assessment and care. EMS personnel conduct assessments to determine the patient's condition and provide necessary care. 4. Transport to medical facilities. If further care is needed, the patient is transported to the nearest medical facility. 5. Handoff to hospital staff. Finally, the EMS team hands the patient off to hospital staff, relaying crucial information about the patient's condition and the care provided. EMS systems can vary in structure. Private versus public EMS services. Private EMS services are for-profit, while public services are typically funded by local government. Fire-based, hospital-based, and third service models. Different municipalities might have fire departments providing EMS, hospitals running their services, or independent third service models focusing solely on EMS. Despite their essential role, EMS systems face challenges: funding and resource allocation. Many services struggle to secure adequate funding, which impacts their ability to provide optimal care. Training and personnel issues. Ensuring well-trained staff and reducing turnover rates are ongoing challenges for many EMS organizations. Coordination with other emergency services. Effective communication with police and fire departments can sometimes be a barrier during emergencies. The future looks promising for EMS. Impact of technology. Innovations like telemedicine and mobile health applications enhance how care is delivered and improve response times. Trends in patient care and service delivery. With an emphasis on patient-centered care, EMS systems are adapting to provide more comprehensive services, including preventative care and mental health support. As we wrap up, we've seen how EMS plays an essential role in saving lives and enhancing community health. Continuous training and system improvement are paramount to meet the evolving needs of our communities. Thank you for your attention.